Have you ever taken medication without a doctor's prescription? It's a fairly common practice, isn't it? You feel a little under the weather, a minor headache or a nagging cough, and you reach out for over-the-counter drugs or dietary supplements. This is what we call self-medication, and it's more prevalent than one might think. However, what seems like a quick, convenient solution could potentially be hiding a myriad of dangers. Self-medication, especially with psychoactive drugs or antibiotics, can lead to detrimental effects on both our physical and mental health. It's a slippery slope of temporary relief that can exacerbate symptoms and even lead to addiction or physical dependency. Today, we're going to delve into this topic from a doctor's perspective. We'll explore the nature of self-medication, its potential risks, and its impact on public health. We'll also look at alternatives to self-medication that are not only safer, but also more effective in the long run. First, let's understand what self-medication is. At its core, self-medication is the act of using substances or influences to administer treatment for physical or psychological conditions without professional guidance. This can involve over-the-counter drugs, dietary supplements, and even psychoactive substances like recreational drugs and alcohol. Now, while it might seem like an easy solution to a health issue, it's important to note that the nature of self-medication is complex and fraught with potential dangers. The practice is often based on the self-medication hypothesis, which suggests that individuals gravitate towards specific drugs based on their effects and the individual's psychological state. This choice is not random, and it's driven by a desire to manage a specific condition. However, without the proper knowledge and understanding of these substances, individuals can inadvertently harm their health. For instance, self-medicating with antibiotics is a common practice that's been identified as a primary reason for the evolution of antimicrobial resistance. This is a serious public health concern that threatens the effective prevention and treatment of an ever-increasing range of infections. It's also worth noting that the appeal of specific drugs can differ from person to person, further complicating the issue. What works for one individual may have adverse effects on another, making self-medication a risky practice. So, while it might seem convenient, self-medication can have serious consequences. It's a practice that requires a deep understanding of the substances involved and their potential effects on the body and mind, which most of us lack. Therefore, self-medication is a practice that should be approached with caution, if not avoided altogether. Now let's delve into why self-medication is a risky practice. When you're feeling unwell, it's natural to want to feel better as quickly as possible. But the quick fix of self-medication can have serious consequences. For starters, diagnosing oneself can be a treacherous path. Without the right medical training and information, you might misinterpret your symptoms, leading to an incorrect diagnosis. This is particularly concerning when it comes to serious conditions that mirror common illnesses. For instance, consider antibiotics. They're designed to fight bacterial infections, but how many of us can accurately distinguish between a bacterial and viral infection? Misusing antibiotics can lead to antibiotic resistance, a significant global health concern. Next, there's the issue of dosage. Medications are a delicate balance. Too little and they might not work. Too much and they can cause harm. Over-the-counter painkillers, for example, can provide relief for headaches or minor aches. But excessive use can harm your liver, kidneys, and even lead to addiction. Now, let's consider the risk of drug interactions. Our bodies can react unpredictably when different medications meet. This can lead to harmful side effects, but it's not just about individual health. Self-medication also affects public health. When we dive deeper into the ripple effects of self-medication, we soon realize that it doesn't stop with the individual. It reaches far beyond, impacting our communities, our healthcare systems, and indeed our world. One prime example is the rise of antibiotic resistance, a pressing global health concern. This occurs when bacteria change in response to the use of antibiotics and become resistant. When we self-medicate, especially with antibiotics, we contribute to this problem. Why? Well, people often use antibiotics incorrectly, such as taking the wrong dosage or not completing the full course, which allows bacteria to survive and adapt, becoming resistant to the very drugs designed to kill them. This resistance is not a localized issue. It spreads across communities and even across borders, making previously treatable diseases harder to combat. Imagine a world where a simple infection could be deadly because our antibiotics are no longer effective. That's a world none of us want to live in. Moreover, self-medication can lead to an increase in drug dependency, putting a strain on healthcare services. This dependency often spirals into addiction, which can create a cycle of ill health and hospital readmissions, driving up healthcare costs and tying up resources that could be used elsewhere. Lastly, self-medication blurs the line of accurate disease surveillance. When people treat themselves, illnesses go unreported, making it harder for health organizations to track disease trends, respond to outbreaks, or plan for healthcare services. This lack of data can hinder public health initiatives and make us all more vulnerable to health risks. In essence, the actions of self-medicating individuals can create a domino effect, impacting public health on a larger scale. Self-medication can breed resistant bacteria, increase healthcare costs, and muddy the waters of disease surveillance, all of which can have serious, widespread consequences. Therefore, self-medication isn't just a personal issue, it impacts us all. So, if self-medication is not the answer, what is? Well, the answer lies in healthier alternatives that prioritize your well-being and long-term health. First and foremost, seek professional medical help. Doctors, nurses, and other healthcare providers are trained to understand the complexities of the human body. They can accurately diagnose and treat your health issues, taking into account your overall medical history. They can prescribe the right medication at the right dosage and for the right duration. They can also monitor your progress and adjust the treatment plan as needed. But it's not just about seeking help when you're sick. Regular checkups are key to catching potential issues early on before they become serious problems. Remember that early detection often leads to more effective treatment. Another healthier alternative to self-medication is maintaining a healthy lifestyle. This includes eating a balanced diet, getting regular exercise, ensuring you get enough sleep, and managing stress. These habits can boost your immune system, improve your mental health, and reduce the risk of chronic diseases. Vaccinations are also a crucial part of preventive healthcare. They protect you from serious diseases by training your immune system to fight off specific viruses or bacteria. Make sure you're up to date on your vaccinations. And last but certainly not least, education. Educate yourself about your health and the medicines you take. But remember, while the internet can be a helpful resource, it cannot replace the advice of a healthcare professional. Always consult your doctor or pharmacist if you have questions about your medication. In conclusion, healthier alternatives to self-medication revolve around professional medical help, preventive measures, and a healthy lifestyle. They're about taking a proactive approach to your health, addressing issues as they arise, and making informed decisions based on professional advice. Remember, your health is your wealth, so take good care of it.